equipment and building and modernizing laboratories and research facilities all across America. And that's also what the Recovery Act is all about. It's not just about creating make-work jobs. It's about creating jobs that will make a lasting difference for our future. From the beginning, our goal has been to rescue the economy at the same time as we're laying a new foundation for lasting economic growth. And central to that foundation is a healthcare system that can deliver the treatments and cures you discover in an affordable way. After all, decades of research make no difference to the family that is dropped from an insurance policy when a child gets sick. And breakthroughs with the potential to save lives don't matter when your insurance doesn't cover a pre-existing condition. And as costs rise and rise, that leaves less and less for the kinds of investments in healthcare and in basic research that will actually improve our well-being. That's why we're working so hard to pass long overdue reforms. Now, I should point out there are some who have opposed the reforms we're suggesting, saying it would lead to a takeover by the government of the healthcare sector. But this concern about the involvement in government, I should point out, has been present whenever we have sought to improve our healthcare system. Here's an interesting quote from FDR. He addressed it nearly 70 years ago right here at the dedication of NIH. And he said, I quote, "Neither the American people nor their government intends to socialize medical practice any more than they plan to socialize industry. In American life, the family doctor, the general practitioner, performs a service which we rely upon and which we trust as a nation, and there can be no substitute for the personal relationship between doctor and patient, which is a source of strength of our medical practice in our land." FDR was being accused of a government takeover of healthcare. But he thought NIH was a pretty good idea. And think about everything that's happened and all the lives that have been saved and all the progress that's been made and all the commercial activity that's been generated as a consequence of that early investment. Now, these words are a reminder that while we've made great advances in medicine, our debates haven't always kept pace. And these words remind us that there have always been those who argued against progress, but that at our best, we've never allowed our fears to overwhelm our hopes for a brighter future. That's been at the heart of the work of the National Institutes of Health for decades. It was here that Dr. Roy Hertz would develop the first successful cure of metastatic cancer through chemotherapy, as a group of women who would have surely died began actually to get better. It was here that Dr. Nina Braunwald, the first woman ever to be board certified in cardiothoracic surgery, conducted some of the earliest operations to replace heart valves. It was here in the years after President Roosevelt's visit that polio vaccines would be tested to end a scourge that affected millions, including, obviously, the president that helped to make the research possible. We can only imagine the new discoveries that will flow from the investments we make today. Breakthroughs in medical research take far more than the occasional flash of brilliance, as important as that can be. Progress takes time. It takes hard work. It can be unpredictable. It can require a willingness to take risks, going down some blind alleys occasionally. Figuring out what doesn't work is sometimes as important as figuring out what does. All of this needs the support of government. It holds promise like no other area of human endeavor, but we've got to make a commitment to it. And here at the National Institutes of Health and at universities and research institutions across this country, you are demonstrating our capacity, not just as a nation, but as human beings, to harness our creativity and our ingenuity to save lives, to spare suffering, to build a better world for ourselves, our children, and our grandchildren. That is our great promise, and it is one that we've once again begun to fulfill. So thank you for your extraordinary work, and we are going to keep on providing the support that you need. The American people are looking forward to the next set of discoveries that all of you are working on today. Thank you so much.